My doctor told me that it weakens bones over an extended period of time, but they never told me a thing about tumors on the brain. So this comment is referring to the Depo-Provera, which is a long-acting reversible contraceptive injection that is injected every 12 to 13 weeks, and it's more than 99% effective as a form of contraception. This is because it stops the body from releasing an egg each month, and if an egg is released, then fertilization of that egg is very unlikely. Now, these injections are sometimes stopped after 2 years, but you can keep having them for longer. It all depends on your individual circumstances and risks. This is because if you have these injections for a long period of time, your bones may become weaker or more fragile, but this is not guaranteed to happen. And you can help to prevent this by exercising regularly and making sure you get enough calcium in your diet. Getting enough calcium in your diet helps to strengthen your bones. Milk, cheese, and leafy greens also contain lots of calcium. If you do stay on Depo-Provera for more than 2 years, a doctor might suggest a bone scan to check the strength of your bones. Now, I am going to caveat this by saying that in the US, the FDA have stated that the Depo-Provera contraceptive injection should not be used as a long-term birth control method, i.e. longer than 2 years, unless other birth control methods are considered inadequate. It does not cause infertility, and periods should return after you stop having the injections. But how long this takes can range from a few months to over a year. Regarding brain tumors, there was an article earlier this year in the BMJ that links the Depo injection with an increased risk of meningiomas. Now, this type of tumor is rare. It's usually benign, slow growing, and doesn't usually spread. However, this paper suggested that there is a 5 times excess risk when medroxyprogesterone, so this is the hormone used in the Depo injections, is given for over 1 year. But we need to remember that a 5-fold increased risk of a rare thing is still a rare thing. So if we look at the numbers, the risk went from 0.01% to 0.05%. This meant that 9 patients out of more than 18,000 developed this tumor. Now, more research does need to be done in this area, but just from this paper, I'm not 100% convinced that guidelines and medical practice need to be changed just yet. And please remember that there are lots and lots and lots of different types of contraception available, and the one that is best for you depends on your lifestyle, your general health, and your personal preferences.